What I want to see, there's compounding pharmacies that are out there. There's 22 of them at the exhibit hall. We by far dominate the exhibit hall. And compounding pharmacists usually takes raw material, in this case of bioidentical hormones, and we use raw material to compound different strengths and dosage forms for the patient. And we can solve many of the problems. Our knowledge base is very good when it comes to bioidentical hormones. And in our case, we probably fill over 1 million prescriptions a year on hormones, so we see most anything and everything. But you have to make a choice. If you're going to start getting into bioidentical hormones and you're new to this business, you really need to find a relationship with a compounding pharmacy. The worst thing you can do for your patient is write a script and send them out into the world. Because anybody and everybody is trying to compound now, but not all pharmacists are giving the same quality. It'd be like if I gave 10 of you in this audience the same recipe and I said, bake this cake or make this dinner, I guarantee you we would not get the same dinner or the same cake by all 10 people. There's an art and there's a science to what we're doing, and it's very important if you're trying to get the right dosing. Ideally, if you could visit a compounding pharmacy, would be the best thing, but I know you're busy, you don't have time. So the thing I can encourage you to do is ask the compounding pharmacy if they send out samples of their drugs to an independent lab for testing. We all get certificates of analysis from the chemical companies saying that it's 95 or 98% pure, but is the actual cream or the capsule contain the amount of drug you have? And the only way you can verify that is send it out to an independent lab. Like at our pharmacy, we send out probably 20 to 30 samples a month. I can't send everything that we make because, one, there's a time restriction. It takes about a week. And there's a cost of about $250 to $500 to have a sample tested. So you can't do it to everything because it would just slow down production. But random testing is very important. Now, keeping it legal. With all of the advent of internet and social networks, there is a lot more of publicity of prescribing bioidentical hormones, especially in the area of testosterone and growth hormone. And the FDA does monitor, and the FTC monitors these websites, and so you have to watch your advertising. Do not use hormones for any sports enhancements, weightlifters. You're going to get a lot of you might get younger guys who come in who want to get testosterone because they want to build up their muscles. You really need to stay away from them because I guarantee you they will get you in trouble. Medical board will come down on you. We see it happening not frequently, but it does happen enough to I want to make you aware of it. Remember that you have to have a face-to-face visit with the patient at least once a year, and that's required in almost every state. Using Skype usually does not qualify according to the medical board unless you're in an outlying area where there's no facilities or patients live so far. And remember, keeping at physiological levels. Now, a physician can purchase compounds to be administered into office use. Keep in mind the difference between a compounding pharmacy as a manufacturer has a manufacturer's license. They are allowed to make commercial drugs that you can, if you choose, and if your state allows you to resell them, you can resell them. But compounded drugs are not made by manufacturers. They're made by pharmacists on an individual basis for an individual patient. So we cannot sell you 30 tubes of testosterone and you in turn resell them. That would make us a manufacturer and that would be illegal. But you can purchase compounded drugs for administration in your office. So let's say you're doing procedures and you want to use a triple anesthetic cream. You can use it. Or if you want to give an injection in the office from a compounded drug, that's permissible. But to turn around and use 1 cc of the vial and give the patient the other 9 cc's and charge them for that vial, you cannot do that. Every state has laws that prevent you from doing that, and the federal government has laws also to prevent you from doing that. So you cannot resell a compounded drug, and you can only administer it in the office. And remember, with controlled substances, you cannot order for yourself. Like if you're interested in using testosterone, you just can't use it for yourself. You have to have one of your colleagues prescribe it for you. Now, Ron's going to go into a lot more detail on hormones, the synthetics versus the bioidenticals, so I won't spend a lot of time on it. I just want to go over some of the key points. The basics of this was developed by Jonathan Wright 20-some years ago using Tri-S, which was a combination of 10% estrone, 10% estradiol, and 80% estriol. And the body can convert from estradiol to estrone depending on its needs. So as a result, the thinking was, let's stay away from the estrone because some people think there's an association of breast cancer with the estrone. So by using just the BIAS, which is the standard formula now for female hormone replacement, which is 20% estradiol and 80% estriol, and you can use different combinations now, 50-50. If the patient doesn't get relief, you need to bump up usually the estradiol because that's the most potent, I should say, of the female hormones. Estrogens can be prescribed orally or transdermally. Patients want the convenience of an oral dosage form, but when you have estrogens, there's a couple of problems with taking oral dosing. One, you have the first pass effect with the liver. It stimulates enzymes, so as a result, more of the drug is broken down. It lowers your IGF levels, so as a result, you're not getting the benefit of your growth hormone. And it increases sex hormone binding globulin. So the more SHBG you have available, the more it ties up your hormones, and the less that is available that's free to float around and get into the cells. So the preferred route is always transdermal. Plus the advantage of transdermal is you're having a slower absorption as opposed to taking it all at one time.